Welcome to Season 2 of Build and Grow, a series dedicated to helping businesses go beyond financial management to achieve financial growth, resilience, and innovation. As businesses continue to revive and pivot to new models in these times, Your Story is proud to partner with HSBC for another season of inspiring conversations, insights, and observations from some of the newest trendsetters in business and stalwarts of the ecosystem. Tune in to power your next phase of growth and business continuity.
Welcome to Season 2 of Build and Grow Money Matters, a series dedicated to helping businesses go beyond financial management to achieve financial growth, resilience, and innovation. As businesses continue to revive and pivot to newer models of business in these times, Your Story is proud to partner with HSBC for another season of inspiring conversations, insights, and observations from some of the newest trendsetters in business and stalwarts of our ecosystem. They are helping their businesses grow to the next phase of growth, and they're ensuring businesses continue and their business continuity throughout. Today we have with us Meena Ganesh, MD and CEO of Portea Medical, India's largest and fastest growing home healthcare company. A little introduction about Meena, okay? Meena is one of India's most successful entrepreneurs with nearly 3 decades of experience in industries including healthcare, consulting, technology, outsourcing, education, and e-commerce. As a partner of the platform growthstory.in, she is also co-promoter and board member of technology-enabled startups, including Big Basket, Bluestone, and more. Meena co-founded one of India's pioneering BPO companies, Customer Asset, and has worked with Tesco, Pearson, Microsoft India, PwC, and NIT. She's an IIM Calcutta alumni. She was confirmed the Distinguished Alumnus Award. She has won the ET Startup Award and several other awards to her name. She was recently conferred the Kempegowda Award by the City of Bengaluru for contribution in the healthcare space during COVID. Meena serves on the board of Pfizer India, PNG Limited, Manipal Senior, and Axis Bank. She has also been part of the board of governors of the Indian Institute of Management, Calcutta. Meena, that's quite an impressive CV, and many of us aspire to do that. Welcome to the show. How are you?
Very well, thank you, Vishal. Pleasure to be on the show.
You know, this show is about build and grow, right? Money matters. So I want to talk about the startup itself. You know, when you set it up all those years ago, you know, you started it out of a need that arose in your personal life, right? And it's now completed more than 3.5 million patient visits across 21 cities. How was the start for you, and how has the journey been so far?
So, Vishal, I started Portea in the year 2013 after we exited from Tutor Vista, which we had sold to Pearson. And prior to that, I had been working to handle the healthcare needs of my parents, and especially my father, who was very sick with cancer. And while hospitals were very good, and we got a lot of good support from excellent hospitals in Bangalore, and also have access to very senior people in hospitals, so absolutely no issues. But the moment you step out of the hospital, and I brought my father home and I had to attend to his other needs, it was just crazy. There was nothing that was reliable, of a quality that could give me confidence that I can continue to take care of my father's healthcare needs beyond the hospital. And that, it was very clear, is the situation, is the reality for most people, not just for elders, but for anybody who needs continuing healthcare attention over their lifetime. What is the solution? There wasn't one which was reliable and which one could say is going to help me through this. Now, that was the kernel of the idea, because I was very keen to get into the healthcare space after exiting from the education sector. And then after studying the sector, it was very clear a lot of investments have gone into either labs or the facility-based care, but the 70% of healthcare needs of individuals which are at home or outside of a hospital was not being addressed. So my experience as well as a study of the environment told me there was a big gap there which I could possibly build something for.
That's interesting, and these millions of patients in 21 cities. That must have been quite an experience for you. A lot of senior citizens must be thanking you, Meena, for the service that you brought in. And the only way to scale it is the technology, right? Yeah.
Well, yes, the technology has to be a foundation for a business of this nature. 2 reasons. One is that it is a remotely managed business, because while we have offices in all the cities that we operate in, but those offices are small satellite offices. The day-to-day management of the services, or the day-to-day delivery of services, happens at the patient's home. And our caregivers and our doctors and our physiotherapists, nurses, all of them go to the patient's home directly from their home. So it's not that they're coming into office for me to monitor them on a regular basis. So the whole acquisition of customers, the delivery of service, management of the quality of service, the entire commercial aspect, everything has to be done remotely, which means that you need a technology platform.
Yes,
So we invested in
absolutely.
that from day one. We built that out so that we would able to scale to this level that we have.
Okay. In the healthcare industry itself has evolved so much since this pandemic, broke out. I think Portea stands out in this, and there is a reason why. You want to talk about what's happened in the medical industry last 8, 9 months, and why solutions like you are very important.
Yeah. So from the start of pandemic, it has clearly emerged that facility-based care is an important, but only a part of the entire healthcare ecosystem of any country. India, other countries have probably built out a more comprehensive infrastructure. If you look at US or UK, or even in the Asian countries, outside of hospital care has been there. In India, it has not been so. All of us, whenever we have any ailment, we either go to a clinic or land up at a hospital and directly to a specialist. We don't even think about going to the primary care filter, which is a very
Yes.
important thing. So what this pandemic has shown, the importance of different aspects of the ecosystem to be built out and to be given appropriate weightage. So, and for instance, if you look at the whole COVID management experience that the country has had, initially the thought process was in the month of March that anybody who is detected or diagnosed with COVID should be moved to a facility. It could be a COVID care center, or it could be a hospital, and that's where they need to be cared. And there was every effort made to create beds and ICU beds and oxygen beds and so on. But over a period of time, as the numbers grew and ballooned, it was very clear that that was only part of the solution. A. B. There was really no need to move everybody into a hospital, because the level of management that they needed, or the level of supervision that they needed, was enough that it could be carried out at home. So that was one learning. The other is
Right.
that as hospitals and facilities became extremely focused on managing COVID, or if they were not managing COVID, people didn't want to go there because there was a possibility of picking up an infection. It became necessary to provide a lot of different kinds of healthcare services outside of hospitals. Third was that since people were not, during the lockdown, people just couldn't step out, or even thereafter, people didn't want to step out, digital health started to become pretty important, and there was a willingness and ability of people to access at least the telemedicine and teleconsultations through digital mode. So these were three different changes that happened. One, clarity that you need to have beyond facility. Second, people's willingness to take and people's desire to take more healthcare at home. Third, the need to and the willingness to take more healthcare and access
Yeah.
healthcare better through digital modes. So these three different things which changed are in fact tailwinds for the industry that I represent.
Right, and also the COVID, you took so many different steps and new initiatives to help people, right? You had partnerships with government, private enterprises, and you also went to corporate in many ways. You want to talk about some of the services that you've done over the last 9 months?
Sure, Vishal. So the very large, impactful program that we did was with various state governments. We started pretty early on in the journey, around the month of early May. On 4th of May, in fact, we launched the first home isolation remote monitoring program along with one of the state governments. This was a brand new initiative. And as we were able to scale that, the other state governments also realized that this was something which is a key part of the overall COVID management program that they need to have in place. And in this process, we worked with 6 state governments, and we have managed nearly 300,000 patients so far, remotely monitoring them with the help of healthcare workers, and also providing them with doctor consultations at the time when they need. And if things were really looking worse, there was escalation of symptoms, then working with the on the ground staff of the state governments to move them through hospitals. Now, interestingly, out of the 300,000 people that we have monitored, less than 3%, in fact, about 2.5% needed hospitalization of some sorts. So 97.5% of the people we were able to monitor, manage at home, provide them with whatever support they need, and release them out of the home isolation. So think about the huge saving and the huge benefit for the healthcare ecosystem. And the pressure
Yeah.
on the hospitals and the pressure on all the clinics and the facilities would have been immense if all these also had to be taken into the
Admitted.
hospitals.
Yes.
And this, by the way, we worked only with 6 states. There are many other states also which must perhaps may have used other such providers or may have found
Yeah.
their own ways of managing home isolation. But the start of the home isolation, which I'd like to believe we played a big role in pioneering that, has made a big difference to the way this disease was managed. Apart from that, we also worked right at the start. We created a chat bot which we provided to a couple of state governments to help them ensure that the right information was being provided to various stakeholders and individual citizens about this whole disease. They get otherwise, especially initially, there was all kinds of rumors and misinformation that was getting
Yeah. Passed on.
provided, and it was getting shared, and people were getting really worried about what was right and what was wrong. So this was something that it was a curated, medically approved source of data and information that was being shared to the to individuals. We also worked extensively with a number of private players, including insurance companies, where insurance companies wanted to cover the patients for health for COVID. Of course, they had to, but instead of them all going into a hospital, they permitted people to get treated for COVID at home and cover that through their insurance policies, both as cashless as well as on a reimbursement basis. We also did the same thing with some corporates, Capgemini being one of the big ones in that, who ensured that all their employees, if anybody had any suspicion of COVID or they felt that they had been exposed, starting from triaging their symptoms through a doctor consultation to providing them the tests. Then, if they were positive, making sure that they were home isolated and managed. If required, moving them into a
Yeah.
hospital, providing them with any oxygen therapy or anything else that might need at home. All of this we have done. We also set up some community COVID care centers in large housing complexes. So apartment with has got 1,000 house homes with probably 4,000 people could have its own dedicated COVID care center, so that if somebody was detected with COVID, could be isolated there, provided oxygen, and so on and so forth. So we've done a few of those also in different parts of the country.
Yeah. Meena, the social impact is phenomenal, right? One is obviously look at the startup and the revenues and the number of customers and signups and all that. What interests me is how did you manage to do all this in a span of 9 months so quickly, so fast? I mean, do you pick on particular problems and then say, let me solve that first, or do you solve a multitude of problems and then solve it properly? What is your work ethic like if you have to implement so many services during this COVID period?
Well, see, as a startup or as over the last 6 years prior to this, we had already created a very strong technology platform,
Yeah.
which came in very handy. Secondly, we have a strong medical team that understands different kinds of diseases and protocols and how
Yeah.
to manage those. And we also had a strong platform for providing both
Okay.
teleconsultation as remote monitoring. So some of the elements were already there. Now the question was to quickly pivot towards a new solution. So it's not that the organization changed, but we were able to put these different pieces together to offer a new solution for a problem that was starting to build up. So it was
Okay.
about the flexibility that the organization has to assemble the various pieces, make the changes that are required. So obviously the platform that we had, the technology platform, was probably 80% ready. We had to add another 20% there to make it right fit for this problem that we were trying to solve. So certainly the pieces were there, but assembling them, creating a new wrapper, making some changes, was something which was there was a heroic effort that the teams put together. And literally in a matter of 2 weeks from the time we started to talk to first state government to the time we started to monitor patients, if all these pieces had to be in place, getting the healthcare workers, training
Yeah.
them, getting the teleconsult ready, getting a platform ready, reporting mechanisms, creating protocols for the calling, creating the protocols for the escalation, protocols on the ground work with the government. It was absolute mad work, and I still have PTSD from those days, I think. But the amazing the teamwork that they did that. Now, once we had done that, the rest of it was more modifications and
Yeah.
changes to meet the other state governments. The interesting thing is that the solution we created for one state government didn't mean that it worked for the same state government through the entire period, because the whole protocol for COVID management evolved on a literally on a daily basis. So there was one
Correct.
protocol on day one. 3 days later, the government would say, no, no, but we're going to do this, not that.
I
It was
agree.
it was just crazy the amount of change that happened, because everybody, including the medical fraternity and the governments, are all
Yeah.
figuring out their way through to see what is the right thing to do. So for us to be extremely nimble and keep changing basis their requirement was quite an experience, and I think my team learned a lot through that. And what we also realized, I think for all of us, it was a learning that how much we have in us, how much
Yeah.
capability we have
Yeah. Amazing how
to
you pull through
rise
the
up to the
logistics, the whole
occasion.
thing. The logistics that you have to pull through is phenomenal,
Yeah,
because there, you also did community level COVID centers, right? And this was in
correct, correct.
Bangalore. Do you think that's important, and also to scale up with multiple communities across India, or is it only going to be in Bangalore at this point?
No, we do have some community center solutions in other cities
Okay.
as well.
Okay.
Apart from that, we did a lot of on the ground COVID care for patients. So there were people who were COVID positive and wanted full nursing and equipment
Yes.
and everything at their home. So that was another very challenging
Yes.
thing. Initially, we said that that's not something we're ever going to touch, but because which nurse or which attendant will go and stay in a patient's home
Yeah.
who has COVID? But we found that by towards end of May, early June, that some healthcare workers, be it nurses and some doctors, were brave enough to say, yes, we are fine. We'll go in the full PPE and we will go take care of the patient. So we were able to. So that was another thing which was very challenging but very
Fantastic.
interesting that we were able to do. Now, while
Go.
all of this was going on, yeah, I was saying that what was important was that while all of these things were going on, it's not that my core business had come to a standstill, right? That was still going on,
Yeah.
providing elder support and post-operative care and chronic disease management. So there was a whole organization which had to be run while all these new things had to be created. So we actually literally created two different teams. That you guys just run the BAU. We are not going to interfere. We'll just assume that you know what to do and you're doing it. And few of us will go just build out these new things. So that was
No,
something.
no, well said. And the next question really, I mean, it's closer to my heart. And I've had uncle I had to help personally through chemotherapy, and taking them to multiple. He was in stage 3, stage 4 cancer that evolved to stage 4. Going to multiple chemos is really painful. And one thing I like about Portea is it has chemotherapy administration at home now. This is a very complex kind of a thing to set up at home.
Correct.
How's that panning out for you?
So this became an ask from both patients and some of the oncologists, senior oncologists. During around June, July, they started to say that we postponed some of the cycles of chemotherapy for our patients because we didn't want them to come into the hospitals, but we need to get on with life. So can we find a way to safely administer chemotherapy at home? Now, why is this complex? One is the kind of medicines and the drugs that are used are fairly toxic. So you need to have a very controlled way in
Yes.
which that gets administered. And the second is that you have to manage for any adverse effects and side effects and so on. So both of these are
Yeah,
important. So
that's true.
taking care of the person who is delivering the service as well as the individual who's receiving the chemotherapy, both are very important. So we had to create a very strong protocol on what we can and what we can't do, which kind of chemotherapy drugs can be administered, in which
Mm.
cycle. For instance, we never start a new cycle, but somebody who's settled into a chemotherapy regimen, and maybe the second or third cycle of that is the one that we would administer. We have to create a full solution for any
Yeah.
adverse effects, any reactions, immediate transfer to a hospital. How do you do all of that? So all of those emergency measures also had to be put in place. So obviously, it's not something we do at scale. It's not the whereas my nursing visits would be hundreds or 500 a day, and
Yeah.
for 2,000 patients are served a day for many other needs. But obviously, chemotherapy will not be in large numbers. But it's very important, and it is done. It has to be done very, very safely. Even before we started the chemotherapy, we've already had the experience, and we still do, of setting up ICUs at home to manage critical patients at home, or patients who are recovering from stroke. So there is a degree of
Yes.
competence in emergency care that combined with this makes it feasible for us to provide this.
The next couple of questions I want to just focus on. This is for the audience that likes these startup questions and co-founder questions, right? Let's move on to that.
Yeah,
And,
yeah.
and I think it's an important question for them because they've seen you raise money from Sabre Partners, Axel Partners, Qualcomm Ventures, and several others. What is the experience like from raising? What is the experience like raising money from these kind of people? And what are some of the strategies that you can tell these young people to follow if they have to win money from these type of VCs? But then your experience would have told you that first focus on the product,
Absolutely. You're absolutely right. You've already answered my question. So, a few things. One is that you need to have a very strong product market fit that you're convinced about and the market is convinced about, and there are people who are willing to pay to take the services that you provide. Of course, you have to do great work, no doubt, but there has to be a fit. It's not enough to have something which is really a fantastic service that people have to be willing to pay for it. So that product market fit becomes super important. The second thing is that most of these grade A funds such as Axel and
Yes.
Qualcomm and Manipal, CDC, all of these expect that it should be a business which is going to scale.
Correct.
So is there a large enough opportunity? Is this going to become something really big? Because they would expect that this is going to get significant. Every time they invest, they're looking for multiples of returns at some stage. May not be immediately, but at a certain stage. So is this market big enough? Is this going to be scalable?
Yes.
And the third is the team. Are they comfortable with the team? Both the founding team as well as the leadership team, do they have in them all those competencies that are required to scale and deliver the value that the customers are looking for, so that eventually you can deliver value to the stakeholders?
That's great points. And the fact that a lot of the founders come and ask me, do I need a co-founder? And you've appointed Vaibhav Tiwari as co-founder. And he's been, phenomenally successful in the last 9 months because of the pandemic. I've read a lot that he's conceptualized a lot of strategies for you. Do you think it's important to have a co-founder, number one, for a person who's freshly started up? Second is, how do you measure success with a co-founder? How do you and Ganesh, I know, would know that answer very well, but how do you bounce it off others, please?
Yeah. See, all the companies that Ganesh and I have started, where we have co-founded, but we've always had one or two other co-founders
Yes.
also. And in fact, Vaibhav has been with me from day one as our chief operating officer, and he has helped build this company in effect as a co-founder. So it was more about recognizing what he had contributed and also bringing him on the board of Portea. That's the change that we made recently, as you refer to the announcement that we made about his becoming a co-founder. Now, speaking about the importance of co-founder, I think the journey of a startup is a very, very challenging, with a lot of ups and downs. You need people you can trust. You need people who can bounce ideas off, and who can also be somebody who can tell you what will work and what will not. You don't want somebody who is doing a yes to you. You don't want somebody who is just following your instructions. But you need someone who will come back and tell you this is wrong. That's super important as well. So having co-founders who you can treat at the same level, who come with different backgrounds or different experiences, and have the ability to look you in the eye and say what is right and what is wrong, I think is absolutely important.
Okay.
It makes sure that the company goes to a better outcome, but also provides you with the support during the ups and downs that you go through. And Portea has, as every other company,
Yeah.
gone through its own challenges. Whether we are doing the right thing, will this work, not work, what should we do? And having somebody who can weather those storms along with you as much as weather those heights or reach those heights along with you is very, very important.
Well said, Meena. Meena, next question focuses on some broad strokes, macros of healthcare. Healthcare is such a huge subject. We could spend an entire day talking about it. Let's focus on the home healthcare segment. I'm glad that the government really, in March, they said telemedicine has to be done. It had very
Yes.
hazy rules, right?
Yes.
Yeah, but there are still challenges. Everybody talks about digital transformation of healthcare, right? But what is sustainable? What do you think is the right way to win on board and engage patients and customers? Like you said, in India, we straight away go to a specialist without going to the primary healthcare center.
Correct.
You might not, and therefore wasting time with that specialist where he really has to give care, he or she has to give care. Your thoughts on the challenges and where are we transforming?
Yeah, so a few things. One is, of course, digital infrastructure for health is very, very important. And the government has also created that digital health mission, which is looking at how the different pieces of digital capability can be brought into health, whether it is a patient ID or a digital records of a patient, knowing which are the right and validated providers, doctors, and so on. So that is something which is required as an infrastructure so that all the different elements of the healthcare ecosystem can be sewn together. That is one thing which is missing in this country.
Yes.
Even if we have primary care, we have secondary care, tertiary care, they don't talk to each other. Each one has its own ways of working. Each one has its own records. The data doesn't flow. Then insurance has its own data flow. So there's so many different pieces that need to be sewn together. So that is one change that needs to happen, and I think these are baby steps that we are making in that direction.
Okay.
The second thing is the importance of the role that the government should play versus the role that the private sector has to play in the healthcare ecosystem. In India, while we talk about private healthcare as being important and being front and center, actually the value of the size of the private healthcare ecosystem, the healthcare system business is very small in comparison to the overall healthcare spend that happens in the country, especially when you compare it to the other parts of the world. So it is small, it is sub-scale. So when it comes to the role of the government, I think we need to be clear, should the government be the person, the entity that is the provider? Is it the payer, or is it setting the standard? In my view, the role of the government is more important in being the standard setter and the payer and the regulator, rather than trying to be the provider as well. Perhaps there has to be some clarity on that so that all of this can work together. Third is to appreciate the role of different parts of the delivery ecosystem. Not just home, not just community, not just facility. It's a combination of all of these. How do all these different pieces play a role? So these are some of the important changes, some of the important transformations that need to happen in the healthcare ecosystem. I think the pandemic has been a huge eye-opener for individuals, for the providers, as well as for the regulators. So we all have to come together and determine what's the best way forward for this country in the healthcare.
Okay. And the new normal, like you said, is going to be digital health. So the government has to figure out, is it going to segment people? Are you a fan of saying that we need to segment our healthcare into BOP, the large, fat, middle, and then the creamy layer on the top, and then technology is going to be, and infrastructure is going to be built around this, and there we decide microservices?
Well, I think I fundamentally believe that everybody has to have a base level of healthcare.
Yes.
Now, over and up, so that is something which is there should be a non-negotiable. Everybody should be able to get a minimum amount of good quality healthcare. And I say minimum, it's not the survival level. It has to be good quality healthcare. So that is something that has to be placed, and that is not a BOP or a middle or a creamy layer. Everybody deserves that. Everybody needs to get. So we got to figure that out. Now, over and above that, basis people's willingness and ability to pay, they may take something which is over and above that. That can be left to the discretion of the individual. But this base itself in India needs a lot more of working to happen.
So is that health stack, are you part of that health stack that the government's been talking about? Do you talk to them about it?
Yes. So I am part of this first consortium, and as a
Yeah.
consortium, we've been engaging with the government to help them both think through as well as implement the health stack, that's the digital health program that they are putting
Right.
in place.
Okay, this is a piece of advice for the entrepreneurs in the healthcare segment. Knowing what they know at this point of time with what you've said, what do you advise them to solve? Because healthcare, like I said, has so many categories, so many
Correct,
economic
yeah.
segments. What advice would you give them?
So that's the beauty of healthcare, and you said it as well. You can take any part of it, any sliver of it, and say that is there something that I can build over there. So while Portea we came into the outside of hospital healthcare, and we have created a more comprehensive offer. Each of the businesses that I am creating or I am in, there are people who are creating a small business in that. And yes, that also is something which is meaningful, and you could look at those. And now the other beauty is that the number of people who have access to technology has grown massively. So there are enough people who are willing to access healthcare through digital only methods also. There is also a lot of point of care devices, diagnostic machines that are getting created. So there are solutions, there are opportunities there as well. You can create something just for measuring a certain parameter, and make, if it's meaningful enough, there is economics in that, there are people who will pick that up also.
Yeah.
So there are a lot of small verticals that can get created basis your interest and your skill sets also. So it's a very, very fertile ground for startups to
Ideas.
come up with.
Ideas. That's true. I've saved this question for last simply because I think you said it yourself. You're a spiritual person, and spirituality and is very important for a startup, especially with the high pressure growth. You're a fan of the book The Power of Now by Eckhart Tolle, and during this pandemic time, and so many people face ups and downs, right? Talk about why spirituality is important in a founder's journey. And by the way, guys, just to qualify, spirituality doesn't mean religion, okay? So, Meena, over to you.
Yeah. So I read the book Eckhart Tolle about 15 years back. So that was a moment of reckoning for me of the importance to come back and center yourself. The world will keep being mad, and there's no control over the world. But what can you do? How can you react to what's happening around you is in your hands. So that was from that point onwards, I've constantly gone back to look at where do I stand in the middle of all that? How do I center myself? How should I meditate? I keep studying, and I'm learning newer techniques of meditation so that I can constantly go back and try that out and see what is it that I can do. And especially when things are mad around you, as it has been in the last 10 months, this whole year has been a crazy year. You don't know what is right, you don't know what is wrong, you don't know what's going to happen tomorrow, you don't know what's going to happen 6 months down the line. And as a founder, a lot of companies have gone through extreme pain. They have gone through complete wipeout of their businesses, don't know whether it's going to come back. Maybe small bits have come back. Some people have seen huge growth. Both sides have happened. So when you're going through such tumultuous times, especially as a leader, you cannot afford to be seen also as swaying along with those huge roller coasters that are going around you. How can you remain the beacon of strength for your team, for your organization? Is in your hands. So that is something that can come only when you have a degree of solidity within yourself, and you keep. It's not that I haven't gone through difficult times. My brain also has gone through enough stresses and strains, and there are nights when you stay up anxious. Will this happen? That will happen. What will happen to money? So, but if you can just separate yourself, just step back a little and take care of yourself, not just spiritually but also physically, making sure that you're fit, making sure you're taking care of your mental health. As a founder, you have to be the rock in your organization. You cannot afford to be seen and swaying. So you have to have all these different tools in your tool belt: physical, mental, spiritual, emotional steadiness.
I'm going to come spend time with you and Ganesh because you guys have done it for 25 years. And this is phenomenal. And you were right. The point that you make that you should be the rock of the organization. Don't sway in your thoughts. If you look at yourself from a younger person to now, would you say you're more spiritual now than compared to, say, a few years ago?
Yeah, it is a journey, and I've been constantly trying to grow in that journey. And I do see myself as a much more steadier person than I was, less impacted by what goes on around me, while still being fully engaged in what
I
is going
understand.
on in my life.
Nice. Okay. Okay. We have to get back to the show. So it's called Money Matters. So what is your financial ideology? Getting back to the money, how do you work towards growing your money is a question that a lot of people have asked us. So I'm going to throw it open to you.
Sure. So there are, as an entrepreneur, first and foremost, your objective is to make sure that the you create an economically viable business, and the cash that you have is being put to the best use that you can think of. Not, of course, there are pressures that may come from investors or from looking around you. There is a need to grow very fast, or to protect your against competition. So while all those pressures are there, you need to be clear what is your objective, what is your financial objective, how do you
Yeah.
make sure that your cash is protected for the long run. And I think that as an individual also you have to do the same thing,
Yeah.
making sure that you're keeping your balance really well to whatever you need for today, what you need for future. Is the money being invested in the right kind of instruments which will grow, especially if you don't have a need for some cash right now? How do you put it in those instruments that in the long run will be very useful to you? So managing your short and your long
Yes.
run requirements in a sensible manner is what, as an entrepreneur or as an individual, you need to be doing all the time. And as a it's you can never say that you're financially illiterate. You have to know what's going on. You can't afford to say that my CFO will take care of my finances. As a CEO, as the leader, you need to know every bit of what is going on. Same thing as an individual, and man and woman, and I will underline the woman. A lot of women feel that the finances should be handled by the male. Not true. You must be as involved in your home financials as the man of the house should be. There's nothing which stops you from being as capable, or if not more capable than the men
Absolutely.
in this particular area.
And I hope you managed the money for Ganesh. I'm sure you did. And therefore you're still I want to know this question. There's a question around banks. What about modern banks that you have expectations of? People talk about them being startup friendly. In your experience, how did banks react to all the startups that you built? So going forward, to make it easier for younger startups, what do you expect from banks?
Well, banks, while they may want to work a lot more with startups, they struggle because of the regulations that guide them also. So it is challenging for banks, and I'm on the board of one, so I understand that better now than ever before. So it is, but what banks need to do is to understand the challenges that startups go through, to see, do they want to be part of the journey. They all Banks talk about it, but they also do not have the right solutions for
Yeah.
startups. For instance, extending lines of credit or providing debt to them. The expectation of having collateral, which is the personal property of individuals, those don't work in a startup which is funded by VCs, etc. That can be possible when you, as an individual, is doing a startup. Then you can probably provide collateral. So, how do you create a solution in that situation? Is something perhaps they need to work. But so that's one side. The other side is perhaps they need to, especially for younger founders, they could play a role of helping them manage their funds in a more sensible, short-term, long-term, balanced mode. Currently, they only work more as a provider rather than
Yes.
as an advisor. So perhaps that's another role that they could consider play.
Meena, on that note, you've been a wonderful, wonderful guest. Thank you for being on the show, and that's a take. Thank you so much.
Thank you. It was a pleasure.